Accidents and diseases at the workplace happen at a high rate all over the world, but can be prevented. Coordinated action at the national and enterprise level is improving workplace safety and health, as well as directly benefiting business productivity, cost saving and competitiveness. Building on these positive steps to place occupational safety and health, OSH, on the international agenda is key to ensuring decent work across the world. Every worker has a fundamental human right to a safe and healthy workplace. The ILO's Convention 187 calls for a promotional framework for OSH and the development of national profiles, policies and programs to strengthen national OSH systems. Guided by the provisions of this convention, the EU, together with the ILO's Programme on Safety and Health at Work and the Environment, SafeWork, have engaged in a joint project improving safety and health at work through a decent work agenda. This 3-year project has been implemented in 5 countries across 3 regions of the world, targeting governments, employers and workers. The first step in improving occupational safety and health is to draw up a holistic profile on OSH within each country.
At national level, we have documents such as the National OSH Profile, which gives a picture of the situation as regards occupational safety and health in a country. And this document was approved by a tripartite constituents, so it's an agreement on what is the situation and comes up with some recommendations, some directions on what should be done to improve that.
A significant part of the national OSH country profiles has been to assess their capabilities for recording and notification of occupational accidents and diseases, which are notoriously underreported.
Actualmente solo tenemos el 10% nada más del registro total de las enfermedades profesionales y accidentes de trabajo. Esto significa un deterioro para la salud de los trabajadores que no estamos midiendo.
It is important that all countries continuously improve and strengthen their own national data collection systems on a tripartite basis. This is key to planning effective national and enterprise level preventative programs. The ILO EU project has assisted countries to develop tailored OSH programs at the national level, seeking to establish national advisory bodies that draw on a wide spectrum of in-country expertise. These national programs tackle OSH issues and promote safe and healthy working environments, in many cases tightening and strengthening the legal frameworks surrounding safety and health and improving advisory services and training.
We have developed the national program on occupational safety and health, and this national program basically has identified the objectives and some of the priorities that we need to address.
The national program is a living document. It shouldn't be just left in a drawer, and it should be improved regularly by all the constituents. So this is what we do at national level. Also at enterprise level, our main focus was on improving risk assessment and management practices.
Who is at risk, when are they at risk, and how are they at risk?
Identifying and managing risk are key steps to improve safety and health at an enterprise level. To ensure sustainability, the SafeWork programme organised seminars which trained business leaders, worker representatives and safety and health specialists to become regional OSH advocates. In turn, these advocates educate and disseminate the principles of OSH at the local enterprise level, including the importance of inspections and workplace risk assessments. Leonard and Memory have just performed their first training on OSH.
What is the first hazard which you, the audience was good, looks like they had the hunger for the knowledge, yeah. So I was also happy with that. The problem is that some people think they are wearing PPEs because of the company wants to look that it is abiding to the regulations, but in the real sense, it's yourself. You're protecting yourself, yeah, from the hazards which are there.
It was quite a good experience, and even for me, even as well for them, I could see their faces that they were looking at things they have probably seen years back, but then they wouldn't really notice the risks and the hazards. But then today, their eyes were quite opened, and then they would see that this is a risk or this is a hazard.
I think that there's a lot of acceptance of risk assessment because it allows people to see a process where they're identifying, they're evaluating and they're controlling. They're not just looking at health and safety from a compliance perspective. And I think people actually enjoy that. They can see the benefit of the process and what it might do for their place of work.
Identical schemes have taken place in Malawi, Honduras, the Republic of Moldova, Zambia and here in Ukraine.
Ті практичні завдання, які ми особисто виконували, воно дуже позитивно і переведення України на визначення ризиків, визначення небезпеки, оцінювання ризиків, це призведе до того, що ми працюємо над питаннями охорони праці. Вважаємо, що на даному рівні нашого підприємства вона на належному рівні.
I think this has just come at a time when we will actually use the information and the skills that we have here in our workforce. We've had some problems in terms of hazards in the organization. The risk assessment will also help a lot.
Assessing risks at the level of the enterprise is a key step in ensuring workers' safety and well-being. But to be effective, risk assessment must be part of a comprehensive OSH management system, which establishes a system of priorities and monitoring of these priorities at the heart of the enterprise. Decide what needs to be done, how best to do it, measure results, and identify areas for improvement.
Surveillance of the working environment makes it possible to identify risks, to set up priorities on the way of OSH improvement, and thus the enterprise itself is able to plan the measures to be taken in order to improve working conditions.
The most difficult people to persuade are not government or local officials, but the enterprises themselves. They often believe that anything to do with safety and health will inevitably mean increased costs, and so are often suspicious. Correcting these misconceptions through awareness raising is a crucial component of OSH projects.
Our primary goal was to overcome the wrong notion that safe work and the good business are irreconcilable. We aimed at demonstrating the real costs of occupational accident at enterprise level and demonstrate for the employers and employees how to save money by means of investing in improvement of working conditions.
A healthy worker will be more productive. I mean, if a worker who is not at risk, who is assured that he is not at risk, will work, to the benefit of that organization, he'll be very productive. Yeah, it is only a happy worker who will be productive. And how can you be happy if you know you are surrounded by risk?
Occupational safety and health offers a sound basis for successful social dialogue and consensus building, as governments, employers and workers all have an interest in safe and healthy workplaces.
I believe that through our social dialogue, because there is what we call a tripartite system in this country, which is provided by the law. The tripartite system where employers, government and employees meet. So it is where we actually discuss such issues. Of course, sometimes we tend not to agree, but many times we agree.
The approach is quite good because the starting point, as you noted, we had the participants from the industry, we had the participants from our inspectorate. All of them went through the process. And these people have been trained, they have imparted the knowledge at the enterprise level, and it is our expectation that these participants will also be able to interact with their peers and share the information. So it will really have the multiplier effect that we're looking for.
In Honduras, the pilot project ran an exceptionally successful and coordinated awareness-raising campaign, supported by employers, trade unions and government. Advertising on television and radio, in street advertisements and in the press has given OSH in Honduras a face. The recognizable and widely publicized designs will continue to be used in OSH promotion in the country. And awareness-raising campaigns are brought into focus on the World Day for Safety and Health at Work, held each year on April the 28th.
We believe that there is no decent work where there is no occupational safety and health.
Technical cooperation is one way that the ILO's SafeWork program extends support to countries in need. Adopting global, coherent, preventative strategies around occupational safety and health, as presented in the ILO Convention 187 and other OSH-related conventions, and in consultations with employers, workers and governments, will contribute immeasurably to decent work. Integrating OSH into national development programs, translating these programs into action, working towards the ratification of ILO OSH conventions, and ensuring that education is sustained at all levels will help to lower business costs, reduce the economic and social burden of workplace accidents and diseases, reduce reliance on benefits, and promote OSH awareness within the formal economy as well as the informal economy, where it is even more crucial.
То есть это как бы для нас очень положительный и нужный опыт, который, надеюсь, практическое применение мы сможем потом внедрить и у себя, допустим, в стране, в своей нормативной базе и каким-то образом тоже заинтересовать наших работодавцев к созданию безопасных условий труда.
I've learned a lot so that we can improve where we were failing, but also I have seen that whatever we are implementing, I will try to apply.
The successes that we have seen in the pilot countries can be replicated around the world, leading to safe and healthy, decent workplaces for all.
It doesn't matter who you are in this world. Nobody wants to have to experience, manage, deal with, or be the victim of a serious accident. And I think that health and safety gets a bad reputation because people think it's about regulatory compliance, not about the human issue of ensuring that everybody goes home in the same condition they arrived in.